Hey mates, I'm the land shark hunter, and I'm here to talk to you about a particularly naughty species of land sharks called laws. There are a bunch of them out there, and crikey, if you don't know about laws, they could bite you in the bum. My friend Maple has a group of laws roaming around her workplace. I call them privacy laws, and they are very fond of medical clinics. People are afraid of laws. They feel that they are dangerous and intrusive. They are only dangerous if you don't understand them, if you are unaware, or if you try to avoid them. The best way to keep from getting eaten by land sharks is to cultivate awareness of the laws and learn to live in harmony. Maple and my pet land shark, Toothy, have starred in a short flick to reenact some situations that cause a feeding frenzy if they happened in your clinic.
Saw my friend walk out. What was Dudley in for?
He has explosive diarrhea.
He knows too much. Can you help me out, fellas? Right, Gladys Abernathy. In any situation, she asks herself, WWMD, what would Maple do? Then she does the opposite.
Is this person Dudley's personal representative? Does he have a valid authorization from the patient? Is this in the patient's best interest for this person to know? If I were Dudley, would I want him to know why I was here? I'm sorry, dear, I can't share that information with you. Why don't you run along now and ask Dudley yourself?
Yeah, I'm the maintenance man. Yeah, that's right, the maintenance man. I need to get into your chart room to fix the leaky pipe or something. Yeah, a leaky pipe.
Okie dokie, here's the key. The room is over there. He's not wearing a name tag. He gives me the heebie-jeebies. Who has authorized repairs? Every non-patient, non-employee visitor must sign in, and we must keep the sign-in sheet for at least 6 years. I'm sorry, dear. I will need to see your identification. And after you sign in, I will have someone accompany you while you are around patient charts.
You don't know me, but take my word for it. I'm a computer fixer. Give me your password so I can fix stuff.
Okay. He's not wearing the University of Colorado Health uniform. He should have his own username. We certainly can't share passwords. I bet my boomers that he's trying to hack our system. Horse feathers, I know what you are up to, you hooligan. Now march yourself right out of here before I take my switch to your britches.
Hey, Maple, give me some social security numbers. I have to go commit some identity theft and stuff. Here's $10.
Thanks, dude. Who does this ragamuffin think he's talking to? That just burns my biscuits. Does your mother know what you are up to? Get the HE double hockey sticks out of my office or I will be obliged to give you what for right in the kisser. And stay off my lawn, you hippie. And get a haircut.
Hey bestie, you remember that, super annoying girl who, stole my boyfriend? Let's look up her medical records and, talk
law for our employees to talk about patients or to reference clinic events involving patients on social media, even if they don't mention the patient's name. Maple could face civil or criminal charges for taking part in such tomfoolery. Don't you sass me, young lady. If you think you're going to talk about or even reference my patients on the Facebook, I will be obliged to wash your mouth out with soap.
Hey, young lady, I'm a handsome reporter. Tell me about the accident victim that came in.
Sure. We do not give any information to reporters unless there has been a breach of the protected health information of more than 500 patients. Pipe down, Mr. Fancy Pants. I'm not some ninny who just blabs willy-nilly. That information is none of your beeswax. I will have none of your shenanigans in here. Now shoo.
Maple, I'm just curious about what happened in the accident. I'm not treating anyone involved, but give me all the records anyway.
Righto, boss. It is illegal for clinic personnel to intentionally access any protected health information that is not essential to perform their specific job duties. Accidentally seeing or hearing information is not illegal as long as the employee does not share that information with anyone else and discontinues the access right away. Dadgummit, Dr. Dimmons, you should be ashamed of yourself. Looking up protected health information out of curiosity is not acceptable. Now go right. I will not be a busybody 100 times.
Good afternoon, ma'am. I need to get some records to avert a serious threat to the general public and capture a perpetrator.
Don't you have a warrant? You can't boss me around. If there was a crime on the premises, I would disclose all necessary and relevant information to the law enforcement official. This officer needs help identifying a perpetrator, so I can give him certain types of information if the alleged perpetrator was not a patient who was seeking or undergoing treatment to reduce his or her tendency to commit the alleged crime. Come along, dearie. Let me just take down your name and badge number and have you sign in. Then I will help you with your little caper.
Good day, miss. I have acquired a lawyer's subpoena and an authorization endorsed by the defendant, who is your patient. As decreed in my discovery request, relinquish the aggregate unabridged medical documentation that is currently in your possession forthwith.
I don't know what you just said, but it sounds official. Here's the patient's entire medical records, dude. Be a dear and let me see your papers. Gracious me, I need to put on my readers. Please have a seat on the Davenport while I review these. If this is a grand jury subpoena, I will disclose the information requested and only that information. It would supersede any patient-signed authorization. Tisk, tisk. It is only a lawyer's subpoena. I will not disclose any information without the patient's consent. He does have an authorization, and I will only disclose what the patient has released on this authorization, not what the subpoena demands. I will need to make sure this is a valid authorization.
I am the medical examiner, and I suspect your deceased patient may have been the victim of a crime. I need information to identify the individual and determine the cause of death. I am also procuring organs to be donated. Please give me some information so I can carry out my duties.
Ew, you touch dead people. You are so creepy. I'm gonna pretend I can't hear you. We must disclose information to law enforcement officials, including medical examiners, if a deceased individual is suspected to be a victim of a crime. We must disclose information to coroners and medical examiners as necessary for them to carry out their duties and for purposes of identifying the deceased individual. We must also disclose information to organ procurement organizations. Why, certainly, my dear. Here is the information you need.
I am treating a family member of a deceased individual. Please get the deceased person medical records for the treatment purposes of this family member.
Yeah, right. Show me the dead guy's authorization first. We may share a deceased person's protected health information with a healthcare provider for treatment purposes of a living family member. We do not need authorization from their personal representative for that. In all other cases, we must treat the deceased individuals exactly as living individuals for the purposes of information disclosures. Of course, Dr. Tapes, I know we can get those records without an authorization, so I will request the pertinent information right away.
April, my patient is a 14-year-old who wants contraception. Call her parents and get their consent for that, please.
Okay, Dr. Clydesdale. A minor may lawfully obtain certain treatments without parental consent. It is against the law for us to disclose such information without the minor patient's signed authorization. We should inform the patient that if their parent's insurance company is going to be charged, they will probably send an explanation of benefits to the subscriber that lists the services provided. Dr. Clydesdale, your patient may lawfully obtain this treatment without parental consent. We are bound by law to maintain your patient's privacy in such matters.
April, my laptop got stolen out of my car. Don't tell anyone about it, but give me a new one, okay?
Okay, Dr. Ding. The number one cause of security breaches is lost or stolen unencrypted portable devices. Dr. Dang, you know we have to report the stolen laptop. But don't worry, dearie. That laptop is password protected, as is access to the private network. In addition, all information is encrypted, so we do not have to report this as a breach to the Department of Health and Human Services.
I just saw a psychiatrist. Break down my notes for me.
Wait a minute. I'm looking at my husband's lab result. Oh dear. It is illegal for Maple to access her husband's information if it is not necessary to perform her job. As a personal representative, she does have the right to request access, but she must follow the procedures any other patient would to make such a request. She should fill out a written request form while she is not working, such as during a break, and have another employee authorize the disclosure. Patients do not have the right to access any notes documented by a mental health professional. These notes are kept separate from the patient's medical and billing records.
Give me the records of all your patients who have been exposed to the black mold.
You're weird. You go trick-or-treating at some other clinic, you freak. He showed me his identification, and Colorado law does require disclosures to avert serious threats to those able to prevent or reduce the threat. This person is definitely able to prevent or reduce this type of threat to the general public. Heavens to Betsy, that mold could cause serious and permanent health problems.
Don't send my notes from today's visit to my insurance company. Just send me the bill, lady.
Take a hike, Jack. Gracious me, unless this is a workers' comp claim or some other disclosure required by law, our patients do have the right to request that we not disclose this visit to the insurance company, so we must be very careful not to do so. We will only grant such requests if you pay in full out of pocket on the same day as the visit. Joey Johnson, Dr. Dimmons wants to know if you've been taking your meds for your psychotic episodes.
Crikey.